So this is your 10-minute milk bite about engorgement. Now, engorgement is normal. This is where your colostrum is turning into more mature milk. It goes to transitional milk and then mature milk. What does that mean? You have colostrum in your breast from about 16 weeks of pregnancy. It is there, I promise you, even if you don't see it, even if you don't feel it. You're a mammal and you make milk, and all mammals make colostrum. Doesn't mean you're going to have a successful breastfeeding experience or make enough milk for your baby. It just means it's there when the baby is born. When you bring your baby to the breast or the pump, whatever you're doing, and the baby is taking milk out, and that's talking to your brain, and your brain's like, oh, the baby's here, this is great, and we're going to make milk for the baby. And it takes about 72 hours after delivery for your body to really kick into gear and start changing this colostrum to more mature milk, and then you're going to feel it. So your breasts are going to feel the same day 1, day 2 after birth, soft and squishy, and the baby can learn on that soft squishy breast how to latch, and the colostrum is thick and sticky so that they can learn how to suck and swallow and breathe without getting overwhelmed and flooded with really thin milk. This all is designed by nature to work. Around day 3, you're going to start to feel there's something happening. You're going to feel like these are getting bigger and it's like fuller, heavier, warmer, leaking all of a sudden. Now the baby's like gulping at the breast and the other side's shooting milk out. This is what we mean by your milk coming in. It's always been there. Colostrum is milk. It is just changing in volume around day 3. And this is normal. We want to feel that. That's a good thing. If you're feeling like it's not a good thing, it's very painful, and I am feeling like I have bowling balls and it's just uncomfortable and it's like up into my armpits, you have engorgement that we want to take some comfort measures on. So let's talk this through. Number 1, and this is important. Many of you are going to be like, I can't latch the baby, I need to pump. And so you're going to start pumping and nothing's going to come out and you're going to panic. Sometimes this is not going to work because you have so much swelling in your breast. It's not all milk in your breast. You have swelling, edema, there's a lot of blood flow going on. So there's just a lot of congestion in the tissue, and the pump is pulling on that. So the pump is pulling the swelling down into the areola, and what happens is all the swelling's down the areola and it cuts off the milk duct so nothing can come out. That's not great. But that's what's happening if you're trying to pump when you're engorged and nothing's coming out. What are you going to do if that's the case? Well, let's put some cold packs on your breast. So heat feels really nice, doesn't it? When somebody puts heat on you anywhere, and then it's going to feel nice. But the heat is saying, hey, let's have more blood flow to this breast. That's what heat does. You wouldn't put heat on like a broken ankle or broken wrist. You would put cold on it. It's the same thing. We don't want more blood flow. No thanks. We have enough going on here. We need to cool it down to reduce that swelling and inflammation. Cabbage leaves used to be a thing. It's not recommended officially in public health anymore because of the hypothetical risk of listeria on the cabbage. It's never happened, but they're like, it might happen, so don't do that. So that's what I have to pass on to you, is that cabbage leaves are not recommended anymore for swelling and inflammation. So it's like cold packs on the breast in between your feedings to reduce the swelling and inflammation. Ibuprofen reduces swelling and inflammation, and you're probably taking that postpartum anyway. So keep taking that for helping with this, with the pain associated with engorgement, uncomfortable feelings, and to reduce the swelling and inflammation in the tissue, because we need to open those milk ducts back up. So cold ibuprofen. And then you can do something called reverse pressure softening. So if your baby is like at the breast and like they were latching just fine, but now they're shaking their head no and screaming, and you're like, they don't like it anymore. They are trying to latch, but they can't grab on. That's what the shaking the head is about. It's a rooting reflex. And they're like, I know the milk is here, but I just can't get it. And when you put them on, they're just slipping right off because now they have a bowling ball to latch to or a football. You have to soften this up for them. And this might work with the pump as well. So to do that, you're going to put pressure close to your nipple and press back into your chest wall. And this is firm pressure. Don't hurt yourself, but you're pressing the swelling into your breast. That's what you're doing here. You can do it with one hand. They call this the pedal technique. I say it's a claw, and you get close to your nipple and press in and hold. You can do it with your fingers. You can do it like this. I'll see people saying, do it here for 15 seconds, and then here for 15 seconds, and then here for 15 seconds. It doesn't matter. We're moving the swelling back up out of the areola, and you have to hold it however you're doing it, whatever is most comfortable for you, for at least 60 seconds. The longer that you hold and press, it's pressing swelling up into the breast, and if you hold it for a little bit longer, you're getting a little more pressure and relief here. You need to be ready to latch your baby or start hand expressing if you're exclusively pumping, let's say. When you release this, immediately the swelling is going to start to go back down into that area because of gravity. So you're giving yourself some temporary relief, and you have somebody there with your baby, like sucking on the finger, like, are you ready? Are you ready? And you're going to let go, and then we're quickly going to latch that baby onto that softer areola so that they can now start draining the breast of that engorgement. If you don't have your baby with you, or you're exclusively pumping, you're going to do the same thing and then hand express. So hold this for 60 seconds, 2 minutes, let go, and you might even start to see milk coming out as you're doing this. That's good. And you could start stroking backwards and then come in and hand express to get the milk flowing. If you're that engorged, I probably wouldn't use the pump at all until you feel like this is a little less extreme, because again, the pump is probably just going to pull that swelling right back down into the areola. So you might be in a mode of hand expression if you're trying to exclusively pump or you're separated from your baby. Keep that in mind. When you put the pump on and nothing comes out, are you in a colostrum phase? Are you engorged? Is your pump fitting you properly? So just, it doesn't mean you don't have any milk when nothing comes out of the pump. So that's called reverse pressure softening. I have a separate video on hand expression, so you can watch that. We're doing cold packs. We're doing ibuprofen. The baby, we're feeding on demand and just letting them kind of latch. Don't pump to drain when the baby is finished. You're going to be tempted to do that if the baby drinks and they're milk drunk and you're like, I still feel full. You're going to be very tempted to like start hand expressing or pumping. All of that is telling your body, hey, let's make some more milk, make some more milk. Let's make even more milk. You don't need more milk. We need to calm this all down and just let the baby take what they need. The only time you're going to hand express or do any pumping is if you're like, I just need a little bit of relief because I can't even sleep or think about anything else except my exploding breasts. Take a little bit out. It's okay. But just don't pump to drain because you're going to make this problem worse. Good news. This is a 24 to 48 hour period. So you're going to be okay. In 24 to 48 hours, you're still going to feel full before a feed and then softer afterwards. But it's not going to be this intense, like, I have rocks for breasts now. And I think I hit everything I wanted to hit as far as engorgement goes. So yeah, good job making milk. It's a good thing that your body is changing the volume of milk. So we're going to say, like, this is good. Good job. You're doing a good job. Can you just calm down a little bit? Just calm down a little bit. And we're going to help your body do that and get through this. And then hopefully go on to breastfeeding or pumping for as long as you like.